Hello, everybody. My name is John McDonough. I'm on the faculty at the Harvard Chan School of Public Health in Boston. And welcome to Health or Consequences, a podcast of CommonWealth Magazine where we explore health policy as it relates to Massachusetts. And my partner in crime is Dr. Paul Hattis from the Tufts University School of Medicine. We are delighted to have as a guest today Rick Lord. Rick stepped down in May after
28 and a half
years as the president and CEO of Associated Industries of Massachusetts, one of the leading and most influential business associations in Massachusetts. And Rick has been a key participant in so many parts of health policy over these 28 years. And prior to AIM, you were the budget director for the House Committee on Ways and Means in the 1980s. So you had time inside government. Before that, you worked for General Electric, and that's your whole career trajectory.
Right.
So we're delighted to have you, and we're kind of thinking of this as an exit interview for Rick from his long and very distinguished career in business, government, and Massachusetts health policy. So just want to start. Could you tell us a little bit about Associated Industries of Massachusetts, who it represents, what it does, and why it cares about and was involved in with you health policy in Massachusetts?
Sure. And I want to just thank you, John and Paul, for inviting me to be here with you today. And I can't tell you what a pleasure it's been to work with both of you all of these years on lots of healthcare policy issues, too. And that's one of the beautiful things about Massachusetts is that all the stakeholders tend to work together. So a little about AIM. We were founded in 1915 to represent the interests of manufacturers. So we were a one industry trade group up on Beacon Hill. And it was a time when unions were getting more organized and workers' comp laws were first being discussed, and the state's manufacturers decided they needed to have a voice on Beacon Hill, and they came together and created AIM. We continued to be that voice of manufacturers until the late 80s, when the board decided that we should become a more broad-based employer association. So about 30 years ago, we went from being a one-industry trade group to a broad-based employer association. And so today, AIM represents, I want to say we, but AIM represents about 4,000 Massachusetts employers. Some of the largest employers in the state, like Fidelity and Raytheon and Liberty Mutual, down to mom and pops and kind of everything in between. We go from the Berkshires to the Cape, and pretty much now reflect the Massachusetts economy in terms of the industry makeup.
Mm-hmm. So let's talk about something a little controversial. AIM is one of a number of business organizations in Massachusetts, and most of whom have national counterparts. So your national counterpart would be the National Association of Manufacturers, or?
Yeah, so I would say we're pretty active in two. National Association of Manufacturers, which continues to be that, one industry trade group, manufacturing base. Since our membership now is broader, about 30% of our members are manufacturers, so 70% are in all of the other facets of the economy here. We also participate with the U.S. Chamber, whose membership is more broad-based. So I would say those are the two that we're active participants in, although we're officially not affiliated with them, other than that we pay dues and our members.
So there are other business voices that you've worked with. There's one called the Business Roundtable that has a chapter in Massachusetts and is a national organization.
Yeah.
Just in later part of August, they came out with a major national statement that was signed by, I think, over 100 national CEOs, and they specifically rejected the idea that has been prevalent and popular in corporate America for almost 50 years now, that the sole obligation of the corporation is to benefit the shareholders and nobody else. And for the first time in 50 years, this organization has rejected that idea in favor of the corporation has an obligation to multiple stakeholders, including communities, employees, customers, and so forth. Mm-hmm. How does that controversy play out in the Massachusetts business community? Is it even a controversy? And how did you react and respond to what you saw out of the Business Roundtable last week?
Yeah, so that's a great question, John. And obviously, AIM wasn't part of that because we're not part of the business roundtable. Certainly companies need to be responsive to their shareholders. Those are the people who've invested in those companies to make them a going concern. But I think if you talk to a lot of individual employers, and particularly small to medium-sized ones, they view all of those stakeholders as important to them, particularly their employees, which enable them to be successful, to their vendors, which are part of their supply chain, to their customers. So it was interesting that these major CEOs came out with this statement, but I don't think it necessarily is inconsistent with the views of lots of employers, that they feel that they have obligations to represent all of their stakeholders in some way.
Okay, great. Thanks, Paul.
Let me, in some ways, jump off from that point, Rick. Even though you're stepping back as the head of AIM, you remain on the state's Health Policy Commission.
That's
thinking
right.
broadly about policy issues, but also they're representing, in some ways, business views as an interest.
Right. The seat I had, Paul, as you know, is an employer seat. I was appointed by Auditor Suzanne Bump. So that is the seat that I'm filling at the
That you
moment.
occupy.
Yeah.
And the HPC does oversee, on behalf of all of us, really, the state cost growth benchmark, which for these last few years, at least, have showed data showing healthcare spending overall under control. Wearing more your business employer hat, does that sense of being under control seem congruent with how businesses are experiencing things here in Massachusetts?
That's a great question. And, I've personally been very happy to see that, overall spending in Massachusetts has come below the cost growth benchmark. And AIM was an early advocate for this when this law was actually even being debated on Beacon Hill. There weren't a lot of proponents that there should be a cost growth benchmark to measure how we're doing. And it really was the GBIO and AIM, and you were part of that
I was
effort.
working hand in hand with you at the time.
Yeah,
Boston
Interfaith organization.
yes, right. Which kind of was like strange bedfellows working together to advocate that we should have a benchmark. So was very happy that the final legislation included that. In terms of how our members feel, we were beginning to show that there's the larger employers are feeling like healthcare growth, spending growth has been under control the last several years. Of course, they have a lot more tools to deal with healthcare costs. They can self-insure. They can design their own benefit plans. They're in a much better position to educate their employees. They just have more resources at their disposal. And so the bigger employers seem to not see healthcare inflation as the, kind of real challenge it might have been 10 years ago. For smaller employers, however, particularly in the small group market, which is 50 and under, they don't have those tools, the resources. They're in that market that's group rated, and those premium increases continue to be over the spending benchmark, which currently is 3.1, was 3.6. So they don't feel as comfortable about our success here, and so we have more work to do.
Let me dive a little bit more into that because you mentioned the employees, and if you look at reported averages of employee cost sharing for in healthcare at the time of service, that those have actually increased considerably, over these last 10, 15 years. Again, is that true from the AIM constituency perspective in terms of what's happening with their employees, and do the employers see that as a problem?
Well, you're absolutely right that the cost sharing over the last 10 to 15 years has increased dramatically, and probably the most significant change has been the adoption of high deductible health plans by kind of employers of now every size, from small to large and everything in between, as a way to, deal with, healthcare inflation that wasn't sustainable. Companies provide health insurance to their employees as a benefit, but it's also a cost of doing business. In order to be competitive, they need to, address the cost of doing business in in a way to make sure that they stay competitive in a global environment. So double-digit increases, which we were experiencing 10 years ago, just weren't sustainable for those employers. So, yeah, there was a big shift in more cost sharing for employees. I think that slowed considerably. We do a benefits survey at AIM every 2 years, and what we've seen in the last couple of years is that cost sharing has slowed down as premiums have moderated. And employers are also sensitive to the fact that, they don't want to overburden their employees with costs that are not sustainable. So they do what they have to do in order to be competitive, but, they're also very concerned about not making it too expensive for their employees.
So let's, Rick, take a step back. So in the United States and in Massachusetts, roughly more than half of everybody gets health insurance through their employer, either their significant other or themselves. Massachusetts may be a little bit higher than the national average, but it's all in that ballpark.
Yep.
Does that make sense to you? Does it make sense that we rely on employers to provide such a large bulk of the health insurance coverage in the United States?
Well, that's a great question, John. We're in the situation we are kind of due to an accident of history. It was during World War II when there were wage and price controls on employers couldn't give salary increases, so they started offering benefits like health insurance, and that became the way that, as you said, most employees, people in the workforce, now get their health insurance through their employer. If we had to start all over again, I don't think the three of us would design the system that we have. On the other hand, I don't see us moving off. I know there's a lot of discussion, certainly at the national level in this presidential debate about Medicare for all. I don't see us going off in that direction, at least in the near future. Most people are comfortable with the current system. We've made it work as best we can. And I always think about Massachusetts in 2006. We said, okay, we have an employer-based system, but we have 10% of people uninsured. Let's fill in the gaps rather than redesign the system. And that's exactly what we did. And in 2 years, almost everybody here was insured. So I think we can build on the current system if the rest of the country would be able to work as well as we did here in Massachusetts back then.
I think, though, what some people don't understand, and particularly people who perhaps are really fervent believers in Medicare for all or some kind of nationalized healthcare system, why do employers oppose taking this burden off their back? What do people not, and to a lot of folks who are listening, they just don't get it. Why would employers not leap at the opportunity to be free of this massive obligation and burden that most of the time has nothing to do with the product or service that they sell?
Yeah, that's a great question. Health insurance is an important component of the benefits that employers offer to their workers, and particularly in an economy like we have here right now, where almost everybody is employed. So attracting and retaining qualified workers is a challenge. The benefit package that employers offer are part of the way they attract the types of employees that they're looking for. So it's part of their compensation strategy, and so that's one reason they wouldn't want to see it go. Secondly, I think they feel they have more control, particularly in the larger ones, because they can self-insure, they can design their benefit plans, provide some more flexibility, and would be concerned about losing all of that and having it taken over nationally. And then third, I think there's a lot of evidence that commercial insurance rates to providers help subsidize the public payers like Medicare and Medicaid. So it's not like employers aren't going to be paying into a national system, and who knows what they'll be paying in order to finance, if we did go, for example, to Medicare for all. So it's not like they're going to be off the hook. They'll be paying into that system in some way. And And I think at least right now they feel more comfortable with the system we currently have.
Even if it doesn't necessarily make a lot of sense.
Well, you know, as I said at the beginning, we've had this system for 80 years. It's what everybody is used to. Change is difficult, and the unknown creates a lot of uncertainties. And employers certainly like predictability and certainty. So to completely leave the current employer-based system to go to something else, I think it would create just a lot of uncertainty that they wouldn't be comfortable with.
Okay, let's shift. You were one of the original members of the board of the Massachusetts Health Connector.
Yeah.
And also, since its inception, you've been one of the members and still are of the Health Policy Commission.
Yes.
So two key crucial roles. Now you're just on the Health Policy Commission. How do you feel the Health Policy Commission has done? How's it performed, and how's it met its responsibilities? Can you give it a grade in terms of how well you think it's succeeded and performed?
Yeah. Let's see. I think I would give it an A-.
That's a good grade where I come from.
Yes, yeah.
That is.
Not always easy to earn.
Yeah. Although I thought there was grade inflation at Harvard, John, isn't there?
That too. Just like in healthcare.
Yeah, right, exactly. So the Health Policy Commission was really set up to focus on the cost of health insurance and was given a lot of responsibilities, health care, I should say, and given a lot of responsibilities and tools to try to do that. I think, as I said earlier, the fact that statute included a cost growth benchmark has been really important because it's shined the light on how we're doing every year, which before that nobody paid much attention as rates and costs and spending went up at double-digit increases. So all the work around that, so the cost trends report, the cost trends hearing, the identification of cost drivers, I think has all been really positive and given us some vital information about, what's driving our healthcare system. I think also the fact that we were given not complete authority, as you know, but some authority over mergers and acquisitions that take place in the healthcare marketplace has also been important. And, as you know, back in 2013 and 14, when Partners was looking to expand in Massachusetts by acquiring South Shore Hospital in the Hallmark system, which is just north of Boston, the Health Policy Commission looked at that potential acquisition and decided that it was going to increase costs significantly. And so, we don't have the authority to approve or disapprove of those types of acquisitions or mergers, but we referred it to the AG, who agreed with us, and that transaction didn't go forward. And 15 years ago, it would have, because there was nobody really looking at those types of transactions in the marketplace. So the fact that we have that authority, I think, is important as well. So, we haven't done everything that we set out to do, and I would love to see us. And the HPC actually is now focusing on at least one driver. There's lots of examples of really wasteful healthcare spending, and we know that now. Like the way overuse of emergency rooms. Some estimates are 40% of ER visits are not appropriate. We have high rates of readmissions here in Massachusetts. We way overutilize teaching and academic medical centers for conditions that could be treated in community hospitals. So all of that I put as, that's kind of low-hanging fruit. Most people wouldn't disagree that if we could take that spending out of the system, that would be a good thing. And so right now, the employer community is leading this effort to reduce the inappropriate use of ERs. And, I was very involved with that at AIM with the Mass Taxpayers Foundation, Eileen McEnany. That effort is continuing to go on. I'm really hopeful that they'll show some progress and then tackle maybe another one of those cost drivers. So yeah, there's certainly more to be done, but I think the Health Policy Commission, under the leadership of Stuart Altman as the chair and David Sells as the executive director, have really done a very good job. And I know lots of states have looked at Massachusetts and have or want to replicate what we've done here.
Rick, you mentioned the consolidation issue in mergers and acquisitions,
Sure.
which remains active here in Massachusetts and
Yep.
around the country. You mentioned the partners one, which ultimately at the hospital level didn't go forward.
Yep.
But even though it's past us now, any thoughts about the B.I. Leahy
Yep.
merger, which was put forward under the idea and ultimately approved that it actually could be a good thing potentially for the market by competing against partners? What were your thoughts about all of that?
Yeah, that certainly was the argument that the proponents of the B.I. Leahy merger put forward, that they were lower cost providers and yet high quality, and that they have an attractive brand name, and that as a group, as a merged entity, they could compete with partners, and to the extent that consumers shop around for their care and choose that lower cost alternative, we could lower healthcare spending here in Massachusetts. That was the rationale, basically, for approving that merger. I do think it's inherent upon the HPC, and here's where we probably could do a better job. After these transactions occur, I think we need to do a better job of looking back to see whether we've achieved what was promised during those conversations. So, that one's obviously way too early to know what the outcome is going to be. But
Let me ask you a question that's a little bit forward-looking, although one that does not technically come under the HPC's jurisdiction.
Right.
We heard a week or two ago that now two of our large nonprofit insurers are proposing to merge.
Yeah.
Well, do you think that'll be a good thing if it happens for our state residents and your businesses or not?
yeah, that's a great one, Paul. I hadn't any previous knowledge that even those conversations were going on, so I haven't had a lot of chance to think about it, and I haven't heard from the players, what they hope to accomplish with that merger. So I guess I'll refrain from commenting on that, other than I think individual mergers and acquisitions really do have to be looked at on their own. I think you can't say all are bad or none are bad.
Look at each one in the facts tied to it.
Yeah, I mean, that's what I would recommend. And yeah, I guess I'm just not in a position, not having had an opportunity to study that one in any great detail.
Are there any structural changes that you think might be helpful in terms of the oversight of this activity of mergers and acquisitions and consolidations and so forth? Or do you think we've got the tools in place to do with it? And was Beth Israel Leahy an example where it worked well, or there might have been some other authority that might have been called for?
Good question, John. I actually, there was some debate, as you know, when this law was being passed about whether the HPC could actually stop, a merger or acquisition from going forward, and they weren't given that authority. The authority was to do a cost analysis and then provide that information to the Attorney General. We have a very engaged Attorney General who's very active in the healthcare space, and it feels to me like the current situation that we have is working the way legislators intended it to. So at the moment, I would say things are in a good place.
Okay. So stepping back, 35 years in health policy from the legislative point of view and from the AIM point of view. So quite a vantage point to look at the big waves and big periods of change in which you've been in the middle of them more often than not. Any observations about the Massachusetts health system, health policy making that stick in your mind as particularly important, particularly for people who are listening who haven't had that experience?
So I'll share a really interesting experience from my perspective. So, and John, you know this very well since you were a leader of this effort. In 1988, when Mike Dukakis was our governor, the legislature passed the universal health care law. And it had a pretty significant employer mandate. At the time, it was $1,680 per person, which back 30 years ago was a big number. The employer community in general was not at all supportive of that law. And I'm not sure how actively they participated in the conversations, but anyway, we passed a law with the business community opposed. That was in 1988. There was a long implementation cycle to that law, so things weren't going to happen for 4 years. So after it passed, as everybody knows, Bill Weld won the governorship in 1990. One of his platforms was repealing the state's universal health care law. I went to AIM, and one of their top priorities was repealing the state's universal health care law. So it was a law that I was very instrumental in helping to pass and put together, and then I was going to an organization that wanted to see it not be implemented. And as you know, most of it was a couple of small pieces were implemented, most of it wasn't, and it was eventually repealed. We did some good things in the 90s. As you know, the CHIP program, and John, you were very involved in that, where we helped to insure kids by increasing the cigarette tax, and AIM supported that. But we really didn't get back to serious conversation about universal health care until 2004 or 5. And this time, the situation was really different, and I think the key policy leaders, including Governor Romney and the Speaker and the Senate President, wanted the business community to be at the table, and they really wanted to pass something that the business community support. And, AIM, I was the CEO then, and my colleagues at the other groups like the Chamber and the taxpayers and the Roundtable felt the same, that we needed to be at the table, we needed to be part of the conversation, and with hopefully the goal of coming to something that we could all support. And that's exactly what we did. And that was such a great accomplishment, and which showed me that, if you can get the stakeholders at the table and everybody's willing to give, that you can accomplish some great things. And we did so. And after that, I went around to lots of states because states were interested in how did this ever happen in Massachusetts. And, I would say that the most important thing is you got to have everybody in the room. And maybe because Massachusetts is kind of unique in that it's kind of a small state, and the stakeholders kind of know each other pretty well, and we have that respect and trust. And but it enabled us to do something that, became the model for the rest of the country. And so get everybody in the room, encourage people to compromise, and have a shared goal, which ours was, everybody will have insurance at the end of this.
We used to have the four big leaders from the business community, you from Associated Industries, Paul Guzzi from the Chamber of Commerce, Alan McDonald from the Mass Business Roundtable, and Mike Widmer from the Mass Taxpayers Foundation. All four now have stepped down. You were the last one to do it.
Right.
What about the new generation of business leaders? Do you see a change, or do you see a continuation of that prior attitude that you folks brought to the table?
Yeah, I think you'll see a continuation, John, of that. There hasn't been a lot of legislative activity on healthcare in the last few years when all of these transitions occurred, and myself and my counterparts retiring after many years in those jobs. So there hasn't been the visible role that there might have been 10 or 12 years ago. And it's funny, the legislature, I think, now they're happy with the role of the Health Policy Commission, and they tend to delegate lots of things there that might otherwise be dealt with in legislation. So, but I'm sure and I'm confident that to the extent that this legislative activity or public policy activity in the healthcare arena, that those groups will continue to step up, because even though healthcare premiums have moderated, they're still a big ticket item, and we need to be vigilant.
Okay, Paul.
As a final question then, do you see anything happening between now and next July, the end of this session, on any of the healthcare issues that have been sort of sitting out there a little bit, the pharma issue-related
Yeah.
discussion or out-of-network care? And any thoughts about the current issues, about where it might
Yeah.
go?
Oof. Well, having left in May, I've been happy not to have been front and center on kind of the public policy issues facing the legislature. I mean, the Speaker and the Senate President had both said that healthcare policy is on their agenda. The House in particularly seems to want to address community hospitals and their role in making sure they're financially stable. There are a lot of people that want to look at pharma costs. There's certainly other examples of things that various stakeholders would like to see. It's a great question. I mean, the legislature passed the House and Senate both last year passed healthcare bills in July and couldn't reach a compromise. There were lots of things on the table at that time. So it's a great question. I would say 50-50.
Okay. Well, at least you'll be able to see it no longer as the head of AIM.
That's right.
So,
I'll be happy to watch from the sidelines.
Rick Lord, we appreciate your time today and sharing a little bit both about your history and your thoughts about things. So thank you very much.
And congratulations.
Yes,
Great. Well, thanks, John and Paul, for having me. It's been a pleasure.
our pleasure too.